The growing global concern about the possible spread of new COVID variants amid the worsening health crisis in China. The outbreak is overwhelming hospitals in many parts of the country after the government suddenly dropped its zero COVID policy last month. More countries around the world are now joining the U.S. in imposing new rules on travel from China. Elizabeth Palmer has more on China's COVID battle.
COVID infections may be surging in China, but the young, the fit, and the healthy have lost no time reclaiming their freedom and the pleasures of normal life. It's quite another story in the country's crowded hospitals, where medical staff are working flat out to treat COVID patients, many of them elderly. In his New Year address, China's President Xi Jinping didn't mention the protests that erupted in November demanding an end to restrictions, or the fact that just days later his government abruptly lifted its zero COVID policy, sending the virus ripping through the population. It's still too early to know if or how much Xi's handling of the pandemic has damaged him or the Communist Party. But in his speech, he called for unity and warned of tough challenges ahead. Exactly how tough isn't clear. Social media posts have shown overflowing mortuaries, and rural hospitals like this one in Sichuan lack both adequate heating and drugs. But China isn't publishing reliable data on either COVID cases or deaths.
I think the most we can say is that it's really bad.
One worry globally had been a new lethal variant could emerge from China and restart the pandemic.
Well, the virus is evolving all the time. The information that we do have doesn't suggest that there is any new variant coming out of China.
That is good news. But the current variant is still plenty dangerous, and it looks poised for a second wave as millions of city dwellers travel home to the countryside for Chinese New Year, taking the virus with them. For CBS Mornings, I'm Elizabeth Palmer in Tokyo.